ahead. Alright. You a little nervous?
Yeah, I don't really talk about it much.
Okay.
Therapist is now employing cognitive behavioral therapy to see if she can get a response from the patient.
Well, it's okay. It's fairly normal. I just wanted to let you know I'm here to help, and this is a safe and private place. I want you to feel comfortable talking to me about what happened to you. I want to let you kind of start out with however much you want to tell me about your situation.
Yeah, I think it was about a couple months ago. I was walking back from work, and I was almost at my apartment, and a man, he came up from behind me, and he took me behind the building, and he sexually assaulted me.
And this you said was a couple months ago? I'm very sorry to hear that happened.
Notice how the patient is fidgeting her hands, looking down, and avoiding eye contact with the therapist.
You just want to ease you kind of into coping with your situation a little bit, and I wanted to get an idea of what you're struggling with right now. So are you having trouble maybe sleeping, eating, running errands?
I don't really, I try to avoid sleep ever since it happened because I get nightmares, really bad nightmares. I don't really leave my house often. If I need groceries or something, my friends will bring that to me, and I don't really go anywhere alone either. So.
Okay. So it's kind of clear that this experience is really affecting you. And you said for a couple months now. And so you kind of have this fear a little bit.
Yeah.
So this is affecting maybe your relationships with people. You said you haven't talked to many, but for the few who you do see, it's kind of difficult to talk to them.
Yeah, my family came and visited me a couple times, but they live a couple hours away, so I don't really go and see them. And like I said, I have a few friends who come and bring me stuff that I need, but other than that, I don't really see anyone.
Okay. So it sounds like you're maybe afraid or paranoid to talk to people, even people who are close to you that you maybe do trust, but you're still struggling with maybe trust issues. And so I think you may be experiencing something we call dissociation. This happens when you kind of distance yourself from people or places because you're kind of stuck in that moment and that situation that happened to you. So are there certain maybe things or people or situations that you find yourself really avoiding specifically or kind of having an intense reaction to?
A couple weeks after the incident, I had a neighbor, and he knocked on my door, I guess to give me mail or something, and I freaked out, and I went in my bedroom and locked the door, and I didn't come out for the rest of the day. So I was terrified to open the door. I don't really go to sleep very often. Like I said, I get night terrors, so I avoid that.
Okay. So a lot of these things you said, like your neighbor knocking on the door, that's called a trigger, and these lead you to kind of the negative thoughts, and those thoughts can keep you from running errands, especially by yourself, or getting things done. You know, you kind of find yourself, it's hard to get yourself willing to do these things. And so what we're going to try to do today is target these thoughts or stuck points and try to divert your attention and kind of make you have a more positive perspective, ease you into that a little bit. And so does this sound doable for today?
Yeah, I guess so.
Okay, great. So you said you were experiencing frequent nightmares. Would you mind walking me through that a little bit?
Yeah, the nightmares aren't really ever the same, but I'm always alone in the dreams, and I always have a really unsettling feeling of helplessness and fear. So I'm not always in the same place, but I always have the same feelings.
Right. Kind of like loneliness, so a little bit.
Mm-hmm.
And Do you experience regret often too, maybe that you should have done something?
I feel like maybe if I was more aware or not as oblivious to my surroundings, I maybe could have helped it or seen it coming. And so now obviously I'm very alert whenever I do anything. I'm afraid of it happening again.
Okay, so have you ever heard of PTSD, post-traumatic stress disorder? So this sounds like a lot of the symptoms of that. And
Now the therapist will use a technique called grounding to help the patient get a grasp of reality.
based on that, I think we're going to maybe try this thing called grounding. Maybe try to pull you away from that event a little bit and divert your attention to the safety of your surroundings. So when you're experiencing these nightmares, I assume they occur in your bedroom at night most nights, right? So, and you said you do live alone, so you're just alone in your bed.
Mm-hmm.
So since you don't kind of have someone to seek comfort in, perhaps you could find something in your room, sounds, smells, maybe like pillows or pictures or something that reminds you that maybe when you wake up you're in a safe place, anything like that?
Yeah, I do have a necklace that my mother gave me. It's hanging on the side of my bed. And I don't really use it anymore, but I used to use a sound machine, and that helped me fall asleep because it reminded me of my childhood. Played sounds of the ocean.
Okay. So it sounds like there are plenty of things that you kind of hold close to that are personal that could help you. So I'd like you to kind of start focusing on that if you can, and hopefully that'll help you a little bit ease your tension when you go with the night terrors and stuff. Okay, great. Thank you.
Now the therapist will be using drug therapy and prescribe the patient with 2 different types of drugs to help her cope with the side effects of PTSD.
So it sounds like you're suffering a lot from anxiety and depression a little bit, difficulty sleeping.
Mm-hmm.
So what I'm going to do is prescribe you some Prozac and Zoloft, and these are types of SSRIs, and they'll help hopefully raise your serotonin levels, which ultimately means that it will help you kind of with sleep, kind of some anti-anxiety medication. So just make sure that you take these every day and follow the instructions carefully. Don't maybe take it with meals as it's instructed. And I'll send that to your pharmacy if you can just pick those up. And then there's some side effects, some headache, nausea, and dry mouth that can come with that. But hopefully, as you kind of get into that system and routine of taking that, it'll get a lot better hopefully for you. And just kind of let me know how that works out for you.
Now the therapist is using eye movement desensitization and reprocessing to help the patient become detached from the emotional trauma.
So it seems apparent that you're struggling with anxiety and feelings of regret and powerlessness. I'd like you to try to focus on the experience and kind of the feelings of that experience. And if you could just follow the motion of my fingers, I'm going to move them back and forth, and just follow them as best you can. You think you can do that? Okay. So just close your eyes and focus on those emotions, and take a deep breath and open your eyes and follow my fingers. Okay. So how are you feeling? What thoughts come to mind for that?
I guess I feel a little anxious, nervous.
Okay, it's understandable. So I'd like you to kind of focus on that feeling again for me if you can, and we're going to repeat the same thing. Okay, so close your eyes, get that feeling back in your mind a little bit, and open. Okay. So on a scale of 1 to 10, with 10 being the most disturbing, how disturbing is this event to you right now?
10.
And now I kind of want to shift your attention to more, if you can, try to think of a positive thought that comes with this experience, such as kind of I can handle whatever comes up, or maybe it wasn't my fault, and try to shift that blame away from you a little bit. And when you think of this, how kind of believable or real do those statements seem? How true do they seem to you?
I mean, I guess if I said it more often, I might believe it a little bit more.
Okay, that's a good idea. I actually would like you to now just close your eyes and focus on those positive thoughts and the event kind of at the same time. All right, and open, follow my fingers once more. Okay. So how do you feel about the event right now?
Less anxious. I guess I feel a little bit more relaxed. That fear and the negative thoughts are slowly disappearing. So.
Kind of less intense, you think? Okay, great. So now if you could just rate that event scale of 1 to 10 for how disturbing it might be to you.
Well, I feel the negative thoughts less, so I think maybe a 7.
Okay. And do you believe that a lot of that anxiety, maybe and that pressure is off of you a little bit? Feel a little less to blame?
Mm-hmm.
Okay, great. So I think this is a great start. I'd like to continue this next week and just kind of make sure and keep me updated on how you're coping with the situation throughout the week, and I'll see you next time.
Thank you.
Okay, thank you.